My name is Julie Grimstad, and I'm the president of a group called HALO. HALO stands for Healthcare, Advocacy, and Leadership Organization. We're a group of people that provides a voice for the medically vulnerable. We help families and others safeguard the welfare of patients and protect their lives. HALO is a nonprofit 501c3 organization. We invite you to visit our website at halovoice.org to learn more about the assistance and information that we offer. I want to give you a little background about myself because every person at HALO has a story to tell, and this is mine. I graduated from nursing school in 1969. As far as I knew then, there was universal respect for the sanctity and equality of human life. Patients could refuse burdensome treatment, and we usually respected their wishes if they were reasonable. But one thing that we did not do was deliberately cause a patient's death. In the summer of 1985, a friend gave me a call. She said, "Julie, what do you know about living wills?" I didn't know anything, so she told me about living wills. She said that they were first proposed by the Euthanasia Educational Council, a group that promoted killing people as an answer to suffering or other problems. The Euthanasia Educational Council saw the living will as a foot in the door for the social and legal acceptance of euthanasia and assisted suicide. In fact, that year I was living in Montana, where they had just enacted a living will law called the Rights of the Terminally Ill Act. And this law permitted patients to be starved and dehydrated to death. Also that year, I was blindsided by my first opportunity to be a patient advocate. My next door neighbor, Jane, was 92 years old. She developed a kidney infection. She was a strong woman. She walked the hills of Montana every day, and she was really bright. But she got this kidney infection, and I convinced her to go to the hospital. She did not want to go. She was terrified. She'd never been in the hospital before in her life. The first couple of days she was in the hospital, everything went okay. But then they took her IV out and they put her on a drug called Haldol because she was a bit agitated at night. And this is an anti-anxiety drug or an antipsychotic drug, but it's not recommended for elderly people. It has a tendency to paralyze throat muscles so they can't swallow. I did not know that at the time, but I realized she wasn't eating. When I would try to feed her, she couldn't swallow. So I took the drug list that her daughter obtained for me of the drugs that she was being given at the hospital, and I took them to the pharmacist and asked him what could be causing her to be unable to swallow, and he said it was the Haldol. So we went to her doctor and we said, "Please take her off of this," and he refused. He said, "If you don't trust me, then find another doctor." And so we did. Now, back then, there were no hospitalists, and so we didn't have difficulty finding another doctor. The new doctor was wonderful. He took her off the Haldol. He ordered speech therapy for her to teach her how to swallow again. And within a couple of weeks, she was home and doing quite well. But also that year, that phone call and Jane's case and several other incidents convinced me that there was an urgent need for volunteer pro-life patient advocates. 35 years later, I'm more convinced than ever. HALO defines patient advocate as a relative, a friend, a volunteer, or a healthcare provider who strives to safeguard the welfare of patients. There are many roles a patient advocate can fill, and I'll talk about some of them later. But first, you need to know what we're up against. There's been a drastic shift in medical ethics. There still are many doctors and nurses who respect the sanctity of human life, who strive to protect and preserve their patients' lives, like the second doctor we found for Jane. We're deeply grateful for pro-life healthcare providers, and I doubt anyone goes into medical school because they want to harm patients. However, if you are not already aware, you need to be made aware of the earth-shattering shift that has taken place in the medical culture. A radical, secular view of the human person is being taught in our medical and nursing schools. New doctors and nurses have been taught to view patients through a utilitarian lens. That is, those who don't contribute to society, who are inconvenient or costly to care for, can be cast aside as physically or socially suffering and deemed unworthy to continue living. This assaults the God-given dignity of the human person. This utilitarian mindset can be illustrated by quoting Dr. Ezekiel Emanuel. In 1993, he wrote in the American Journal of Medicine, quote, "Increasingly, it will be our collective determination as to what lives are worth living that will decide how incompetent patients are treated." This mindset literally reduces medical ethics to economics. Dr. Emanuel would later be the chief architect of Obamacare. That should frighten everyone. Biased doctors who decide what lives are worth living are playing God. They're not practicing medicine. Healthcare reform is truly needed, but what we're seeing is unjust cost cutting. The Affordable Care Act made tens of millions of people eligible for Medicaid, but hospitals are poorly reimbursed for Medicaid patients. An insurance card does not ensure access to care. Nobody says it out loud, but healthcare providers' actions show what they are thinking. We need to get rid of this patient. The welfare of people cannot be outsourced to the state. We, the people, must look after each other. That's what love thy neighbor as you love yourself means. So why was HALO created? Why is it necessary? First of all, we visibly love vulnerable patients. And this is a witness to the world that these patients are valuable and worth protecting. We help people navigate the increasingly perilous healthcare system. We defend healthcare providers who listen to the voice of God, that is, their consciences, refusing to participate in unjust denial of care and intentional killing. And yes, intentional killing is happening. A large part of HALO's mission is to increase public awareness of life issues beyond abortion. This is significant because so many good pro-life people don't look beyond abortion. They're unaware of other crucial life issues. We educate people through our publications. We also have a 24/7 helpline that people can call any time of the day or night with questions or needing help. And we have patient advocacy training. I want to impress on you how real the problems we confront in the healthcare system are. Many people implicitly trust their doctors and nurses, and we don't want to unduly frighten people because, as I said, there are many doctors and nurses who can be trusted. However, it's always wise to be wary because there are also many who cannot be trusted. One of the most popular publications that HALO has is Making a Difference, a guide for defending the medically vulnerable. It's 16 pages of information you need to help you protect yourself or a loved one in various healthcare situations. For example, most people don't even know they should carefully check out a hospice before admission. Making a Difference provides a list of questions to ask a hospice before a person is admitted, before signing up for hospice. Unless hospice care is provided by people who truly respect life, it can be very dangerous. Hospice, in fact, is the ideal setting to disguise killing people as comfort care. A typical report from grieving family members is that their loved one, who had been alert and was not complaining of pain, was administered increasingly frequent and larger doses of pain medication and sedatives, to the point where they were no longer able to eat or drink and they were starved to death. Some reported that patients were also denied their usual medications to control things like their blood pressure or diabetes. A large chunk of Halo's work is dealing with the denial of care. Do you know that your hospital likely has something called a medical futility policy? These policies permit doctors and hospital-appointed ethics committees to decide to stop life-sustaining treatment against a patient's or a family's wishes. In my experience, it is frequently the patient's life that is considered useless, not the treatment. Such medical futility decisions assault human dignity. Texas, where I live, has a terrible medical futility law. I attended an ethics committee meeting a few years ago with the mother of a 26-year-old woman who had had a stroke. The doctor claimed she was unresponsive. Just that morning, an attorney had videotaped the young woman responding to her mother's and my questions and requests by nodding her head yes, that she wanted to live, and moving her feet and blinking her eyes on command. The hospital's attorney prevented us from showing that evidence at the ethics committee meeting because, she said, we had not gotten permission from the administrator to take pictures in their hospital. This was a devastating case. The doctor said to the mother, "You'd be better off if she were dead than having to possibly take care of her for many years." So obviously she was not near death. The hospital wanted to kill her. Fortunately, her mother, with help from patient advocates, was able to move her daughter to another facility and save her life. Every time I've been involved in a medical futility case, I've been stunned by the callous disregard for human life displayed by doctors and hospitals. COVID-19 has exposed the vulnerability of the elderly and the disabled, particularly when healthcare resources are considered scarce. We were all appalled at the deaths in the nursing homes in New York. And an example of deadly discrimination against the disabled happened this summer in Texas. Michael Hickson, a 46-year-old COVID patient, was starved and left without adequate treatment for his illness at St. David's South Austin Medical Center. His wife, Melissa, says the hospital refused to treat his illness because of his disability. These things are happening all over the United States and the world. So today our topic is how patient advocates protect lives. There are various levels of patient advocacy, and I hope you will be drawn to some aspect of patient advocacy. A volunteer pro-life patient advocate has an undivided interest in a patient's welfare. Many healthcare facilities and programs have professional patient advocates. Certainly they can help patients in some situations, but they have a divided loyalty. When push comes to shove, will they serve the interests of their employer or their patients? And the same question can be asked about doctors and nurses. Conscientious doctors and nurses who put their patients first risk losing their jobs. If they choose their employer or insurance company over their patient's best interests, they eventually become hardened. The reality of this hardening of heart was brought home to me recently when we supported a family whose 22-month-old daughter was found face down in a swimming pool. She was resuscitated, but to make a long story short, she lost consciousness after a couple of days, and the hospital decided that caring for her was futile. Her faith-filled family would not give up. They insisted on continuing life-sustaining treatment, and they pulled out all the stops, even getting the news media involved. One nurse stated that she had not realized how hardened she had become, but this family really touched her. Often, decisions about stopping or denying treatment are based on biased clinical judgments. But like the Good Samaritan, Halo's patient advocates don't consider a patient's identity, competence, or how long the patient is likely to survive, the cost of their care, or even our personal inconvenience. We are called to embrace life in its fullest at every stage. Most of us will have opportunities to serve as patient advocates. You may be blindsided by it, as I was the first time. When a relative or a friend faces a medical crisis, or when they need long-term care, you need to be there to protect them. It's wise to be prepared, being alert to dangers and ready to take quick action, as well as knowing where to turn for help, may save the life of someone you love. Whether you decide to volunteer in some capacity or just want to be ready, should someone close to you need an advocate, Halo can help you prepare. Here are a few areas in which patient advocates make a difference. Because of COVID-19 restrictions, some types of patient advocacy that I've done for years may be difficult or impossible at this time. For instance, I can't visit the nursing homes right now, which I used to do every week. But there are things that you can do, even if you are restricted from visiting patients. You can educate yourself, and then you can take what you know and educate other people, even your doctors. Explore our website and call us with your questions. We're always happy to answer. You can become a community outreach volunteer. There are opportunities galore. You can serve as a church ambassador for Halo. We have a pilot program underway in Oregon right now. You can talk to local groups about Halo, any club that you belong to. You can email your relatives and friends telling them about Halo's website, or mail them a Halo brochure. You can arrange a conference in your area and we'll provide the speakers. You can also join Halo's helpline. You can answer calls. Halo provides a guide and a training manual and ongoing training and any help you might need. In urgent situations, there's experts we can call for help. You might just want to join our training sessions for your own information, even if you don't want to be working on the staff of the helpline. We receive many different types of calls. We get questions about medical decision-making or healthcare advance directives. We get urgent medical situations when quick action is needed. For instance, we recently had a call from a woman whose husband and father had suffered a severe stroke. The hospital was pressuring her to stop treatment. Halo put her in touch with medical and legal experts to intervene with the hospital. We also get some serious cries for help. For instance, a woman without family support had a terminal brain tumor. She was looking for a life-affirming hospice. Our executive director used Halo's fact sheet on questions to ask a hospice before admission, and she interviewed local hospices and helped this woman find one that was suitable to her. And we get cries for help. I got a call from a woman one day who was an immigrant from another country, and she just simply needed some friends. And so I put her in touch with a local pro-life group, and they helped her. We also have sad reports when a person suspects a loved one was killed in a healthcare setting. Those are really tough. Basically, all we can do with a person who calls with that situation is to console them and offer to pray with them and for them. Sometimes we accompany patients. We take a patient to their doctor appointments. For example, I had a patient named Jay when I lived in Fargo, North Dakota, a number of years ago. And Jay had prostate cancer. I would take him to his Veterans Administration hospital appointments, and we might have to wait a couple of hours to see the doctor. And so while we were waiting, we would prepare a list of his questions and symptoms. And when we'd get in to see the doctor was always in a hurry. And we would, I would kind of block the door so that he couldn't escape. Jay appreciated that, but the doctor didn't so much. But we would cover all of Jay's questions and get all the answers that we wanted. And Jay had trouble understanding this doctor because the doctor was from India. So once we left, I was able to tell Jay everything that the doctor said. We also visit hospitalized patients and nursing home residents, and this is a work of mercy. The deepest kind of suffering that I've encountered is profound loneliness. During the pandemic, we have seen the huge cost of denying visitation. Many people despair. They lose their will to live. Family members and patient advocates can't even be there to ensure they receive proper care, that they're not being neglected or abused. We have lots of information for people to use. Families can use these. This is a particular card that we have, signs of elder abuse or neglect, that you may be interested in getting. Spiritual care is also denied. I know a man who had a heart attack recently, and he asked for a Catholic priest before going into surgery. They sent a non-Catholic chaplain who couldn't give him the sacraments. After surgery in ICU, he asked again, but they wouldn't let a Catholic priest in to visit him. His family was also barred from visiting him. Thankfully, he recovered, but had he died, he would have died alone. And that's been the fate of many people during this pandemic. We try and we are working to ensure visitation rights for patients. You can also join our prayer warriors group. We pray for the sick and dying, their family, and caregivers. And we'll put you on the list and send you notices when we need someone to pray. Of all the skills, though, that a patient advocate needs, one of the most important is the ability to listen, whether on the phone or in person. Really listening to a person means listening with your whole self, intently, and with respect and empathy and patience. Boy, patience is the hardest one for me. Sometimes a person just needs to talk, and I just need to listen. Just sit there and pay attention and listen with my whole self, trying to figure out what they really need, or just letting them get it all out. Equally important, though, to listening to the person who calls or the person you're with is listening to the healthcare providers. What are they saying in their words and their actions? Do they treat the patient and family with respect? Do they provide honest and sufficient answers to their questions and information so that the family can make informed decisions? Are they unduly pressuring the family to stop treatment? For instance, sometimes I've heard this said to patients: we can stop food and water. It's an ethical way to die, and we can keep you comfortable. How do they keep them comfortable? They give them morphine and sedatives while they starve and dehydrate to death. That is a horrible way to die. Do they use dehumanizing words to describe the patient, such as vegetable or a waste of resources or a life not worth living? Or do they extrapolate their own feelings to the patient, saying, I wouldn't want to live like that? Well, they don't know this patient, and because they're usually hospitalists, people who have no clue who this patient is. So they don't know how that patient would be able to live in a certain situation. By observing and asking questions, you can discern which clinicians can be trusted. and which ones cannot. Ideally, we would like to have patient advocates in every community so that when Halo receives a call, there'll be someone in that community to reach out to the caller personally. For example, I got a call from a woman who wanted to die. She was severely disabled. Her husband had left her. She had no family. She had no support system, and she was desperately lonely. She just needed someone to talk to. So I called a psychiatrist, and he assigned a counselor to work with her. And also, another local pro-life group was able to reach out to her. And finally, being a patient advocate is really an opportunity. It's an opportunity to have a new awakening of love for God and neighbor. It's an opportunity to share the love of God with every person we encounter, especially suffering patients, their families, and their healthcare providers. It's an opportunity to comfort the afflicted and afflict the comfortable as we seek to protect lives and soften hardened hearts. We invite you to explore our website at halovoice.org to learn more about what we provide, including our patient advocacy video, which you can watch and learn more about patient advocacy. You can also call the Halo helpline at 888-221-4256. The last 4 digits spell Halo.